General Healy, our colleagues from the Mass Medical Society, and everyone else for being here today on this very important issue for our community. You know, here at Boston Medical Center, we often see the tragic consequences of gun violence, sometimes every day. Our doctors and nurses know that gun safety is a major public health issue. BMC has the busiest trauma center in New England, and we see more gunshots than any hospital in the city. And our trauma team is brilliant at saving lives. And thanks to them, many of our patients recover from their wounds. But the damage to individuals and to families and to their communities is still incalculable. And that damage can last for generations, with some communities bearing the heaviest burden. For example, we know that stark racial disparities exist, with the death rate from gun violence for African American men still staggeringly high. This isn't a question of gun rights or the merits of owning a gun. This is a question about safety for our children and for our families. Most gun owners are responsible and they take proper precautions. But when people don't take proper safety measures, the results can be disastrous. And it's these tragedies that can be prevented, that concern us as healthcare providers. Here at BMC, our pediatrics department has led the way in promoting positive conversations with families about gun safety, the same way our doctors would work with patients to address any potential safety issue in their home. As an institution devoted to the health of our community, we know we can do more. That's why we are so pleased to join this innovative effort with Attorney General Healy, the Mass Medical Society, to help physicians talk to their patients about gun safety. I want to give a special thank you to our Vice President for Mission and Associate Chief Medical Officer, Dr. Thea James, for her leadership, not only on this important project, but on combating gun violence in communities here and around the country. As a healthcare community, we are fully committed to ending gun violence in Boston, starting at every home and at every doctor's visit. Now, it is my great pleasure to introduce Maura Healey, the Attorney General of Massachusetts.
Well, thank you so much, Kate Walsh, for inviting us all here today, for hosting us as you have previous occasions. And I'm just reminded, it wasn't too long ago that Speaker DeLeo and I were here for an assembly of public health school deans from around the country to talk about this very issue. So indeed, we really greatly, I know I speak for all of us, in extending our thanks to you, to your wonderful team and staff here at Boston Medical Center for the work that you do day in and day out, particularly when it comes to addressing trauma and victims and survivors of gun violence. So thank you. I also want to thank my other partners who are here today, because this is all about partnership. And today you see a partnership of the health community and public health, as well as law enforcement. And I think for us to truly try to conquer and reduce gun violence in our state and across this country, it takes these kinds of partnerships, these kinds of initiatives, these kinds of collaborations. So to that end, I want to particularly thank Dr. Gessner and the Massachusetts Medical Society. We partnered on opioid reduction initiatives, and now we're partnering again on this effort to try to help us reduce gun violence in our communities. Speaker DeLeo, who championed important legislation a few years ago that we now see the benefits of when it comes to taking steps here in the state to reduce gun violence and injuries. I want to thank Speaker DeLeo for his continued leadership on this issue. Joining him from our legislature, Representative Byron Rushing, who he and I had a conversation not too long ago about this very kind of idea about how we can empower providers and those in the health community to have the tools to be able to work on these issues. So thank you both for being here. Really delighted to be joined by my colleagues in law enforcement, starting with our police chiefs. We have Chief Deege, who is the newly elected president of the Massachusetts Chiefs of Police Association, as well as Chief Keyes, who is president of the Massachusetts Major City Chiefs Association. Day in and day out, police chiefs and their teams around the state are doing great work under trying circumstances, and we thank them for their partnership in helping us to put forward this initiative. My colleagues in law enforcement standing here today, I'm so proud to stand with them, as I always am. District Attorney Dan Conley here in Suffolk County, District Attorney Marian Ryan, the newly elected President of the Massachusetts District Attorneys Association, and District Attorney Mike Morrissey from Norfolk County. Thank you all for being here today. I also want to acknowledge my team in the Attorney General's office, John Miller, Abby Taylor, and Ben Golden, who worked very hard in this partnership in putting together this program. I want to take a minute, though, to particularly acknowledge Dr. Thea James and Dr. Chuck Morris. Dr. Thea James, as was mentioned, is the Associate Chief Medical Officer here, but also the Director of Violence Intervention, the Violence Intervention Advocacy Program here at BMC and BU School of Medicine. And I know from having watched her over the years the amazing work that she has done on behalf of so many families in our community here in Boston. I want to thank her for that and thank her for her partnership here, and also to thank Dr. Chuck Morris of Brigham and Women's Hospital for his work and participation in this initiative. Now look, folks, we know that here in Massachusetts we have some of the toughest laws on the books when it comes to guns, and we know that those laws are working in many, many respects, but we also believe that any one gun death, one gun injury is one too many. We can always do more to prevent firearm accidents, self-harm, and violence. We know here in this state and across this country, gun violence takes its toll. Every day in America, 7 children or teenagers are killed with guns. Every month, 51 women are shot to death by intimate partners. More than 60% of gun deaths are by suicide. Guns are the leading cause of death for black males ages 15 to 34. Each day in this country, 90 Americans are killed, another 200 injured at the hand of a gun. These aren't just statistics, these are, of course, tragedies, and importantly, they are preventable. That's what today is about. That's why we've come together and we've taken a multi-step approach on the issue of gun violence. Of course, we have a job to do when it comes to getting guns out of the hands of people who are a danger to themselves or others, getting focused on getting guns out of the wrong hands. That has meant that we've needed to do the work, and will continue to do the work, cracking down on illegal gun sales, working with dealers to enforce existing laws, and urging Congress to lift the ban on gun violence research. But we know that law enforcement is only one piece of this puzzle. Gun violence is a public health crisis, and it needs to be addressed as one. Today, I am proud to announce a partnership with the Massachusetts Medical Society to help educate providers and patients and prevent gun injuries and deaths in this state. Our healthcare providers are on the front lines. They have a critical role in preventing gun-related injuries and death. But last year, we discovered screening and counseling about guns remains relatively uncommon. So we started talking to providers across the state about what they would find useful, what they would find helpful in their practice as they engage with patients about this issue. And we learned that many doctors don't feel like they have the information they need to discuss gun safety with patients. Some are unsure whether it's even legal to ask their patients about guns. Others don't know what practical advice they can give. Still, others don't know what reporting obligations exist or might be triggered when it comes to gun-related questions. To answer these questions, we developed 2 educational brochures, one for providers and one for patients. For patients, we discuss gun safety, from safe gun storage to disposing of an unwanted weapon. For providers, we're providing tips for approaching gun-related conversations as well as information about reporting. For providers who are interested in learning more, we've also worked to create an online education program available to physicians for credit through MMS's website. We're confident that this information will help save lives. This has been about coming together and pulling together all of our resources to address this problem from as many angles as possible. We look forward to the ongoing partnership between medical providers, the public health community, law enforcement agency, and others who are working hard to keep Massachusetts healthy and safe from gun violence. My office stands ready to help however we can in this important endeavor. And again, I want to thank all the partners who stand with us here today in this effort.
I want to not only be here for the Attorney General, who I think is probably just one of the best, if not the best, I think, in the country, but to thank her for her past support on this issue. And to be here with so many of our other invitees from the medical profession, obviously, to the district attorneys, to leader in the House, Byron Rushing, to members of the police forces. I think this is a wonderful opportunity for us to be rolling out this most important initiatives. You know, Massachusetts is known for, I think, having the best physicians that there are in the world. And you'll couple this with, I think, with what we now have is the strongest gun violence legislation in the world as well. I think that puts us in a great position to be the safest place in the world as well. And I thank all the professionals for being here, for being such a large part of that. As the Attorney General mentioned, 4 months ago, we were here to attend a conference on gun violence at the Boston University School of Public Health, and I was here alongside with the Attorney General. There, I spoke about how Massachusetts passed one of the strongest pieces of gun safety legislation in the nation. Now, especially in the wake of the new national political environment, I think it's even more important to reflect on what we are doing within our state to keep our residents safe from gun violence. At the conference, I learned how physicians and others are increasingly viewing the gun violence epidemic as a public health issue. I first became really extremely interested in this subject matter, obviously throughout my term as a legislature. But it really hit home, I think, on a drive home one day when I was speaking in Springfield. And on that way home, over the news on the radio came the announcement that some extremely young school children were killed in Connecticut. It became clear to me at that time that although Massachusetts was always known to having one of the strongest gun laws that there have been in the country, that more had to be done. And I quickly learned that although we did have some of the strongest laws in the country, that more could be done. And that's why I'm so proud of our sweeping 2014 law. Did many things that have gained notice. Among them, it permitted for the first time local authorities to deny a firearm identification card for those seeking to purchase shotguns and rifles. Also, authorized licensed gun dealers now could have more access to criminal offender record information. It also required the Department of Criminal Justice Information Services to create an online portal for private sales. It also contained less well-known provisions, I should say, that address gun violence from a public health perspective. For example, we heightened training efforts for educators and healthcare providers. We also directed the Department of Public Health to collect and analyze information on suicides, including those caused by guns. These legislative efforts, I believe, dovetailed nicely with the Attorney General's announcement today and helped contribute to the news last month that Massachusetts has the lowest homicide rate in the nation. I'm proud of that and encouraged with this new initiative of the Attorney General's office, our state can make even more progress. On this area, and in so many other areas, Massachusetts leads the nation. Now more than ever, I am proud to be working with the Attorney General Healey and other elected officials to protect our residents, keep them safe, and maintain our way of life. Over the past years, maybe 2 or 3 years now, as we've been working on this legislation and so many other initiatives of the Attorney General, I'd have to say that I must thank her for all of her efforts with regard to gun violence. The legislation which I have just spoken to, I think a major part of that legislation was the partnership that we had with the Attorney General in her office, and I want to publicly thank her for that. And I look forward to working with her on this and other issues as we move forward, and partnering with her and the medical profession again to keep
To
Massachusetts.
the physicians of Massachusetts, I thank you for the invitation to be a co-sponsor and to participate in today's events. It is an honor to stand here with you, other healthcare leaders, and law enforcement officials to remind everyone what has been evident for some time, that gun violence is a major public health threat. That physicians are collaborating in this event and are taking a stand against gun violence alongside law enforcement should not be considered unusual. For more than 20 years, our medical society has been engaged in efforts to reduce violence in many forms. The physicians of our Committee on Violence Intervention and Prevention since 1995 have provided resources for both physicians, healthcare providers, and patients in areas such as intimate partner violence, bullying, child abuse, and human trafficking. Gun violence has been prominent among these topics. Physicians' efforts at gun violence have been directed at reducing deaths and injuries, making gun ownership safer, promoting education among health providers, and encouraging research to understand the risk factors related to gun violence. The numbers alone, as you've heard, make it abundantly clear that firearm violence is indeed a public health issue. We heard that on the average 90 Americans are killed with guns every day. 15% of those are children and teenagers. And for every person killed by a gun, you heard that 2 more are injured. While Massachusetts stands out with the lowest gun death rate in the country for 2015, the last year for which statistics are available, let us remember that 213 people in Massachusetts lost their lives to firearms that year. Strong firearms laws have contributed to our state's low death rate, but awareness and education must also play very important roles. And the Massachusetts Medical Society is pleased to continue the educational efforts in collaboration with the Attorney General's office and law enforcement leaders across the state in educating individuals about safe storage and disposal of firearms, and in encouraging healthcare providers to talk to their patients about gun safety. These efforts complement our society's continuing medical education courses on firearms violence. Increasingly, physicians are making their voices heard about gun violence. 2 years ago, more than a dozen physician organizations, along with the American Public Health Association and the American Bar Association, asked for a call of action, declaring that deaths and injuries from firearms are a major public health problem in the United States. Last year, the American Medical Association adopted a policy calling gun violence in the United States a public health crisis. Also last year, our medical society sponsored a public health forum on firearm violence, featuring community leaders and public health and law enforcement officials. Attorney General Healy was kind enough to accept our invitation to be the keynote speaker at that event. In her remarks, she highlighted the importance of physician partnership and participation in curbing gun violence. She said it will require a partnership with physicians. Physicians agree, Ms. Healy, and I will conclude my remarks by saying you can count on that. Thank you.